This is News 4 New York.
And later, kudos to the men and women who save lives and care for us when we are at our most vulnerable. This is the start of National Nurses Week. Tonight, 5 things you might not know about nurses from the Visiting Nurse Service of New York. And later, they work hard on your behalf for our comfort. Tonight, we mark National Nurses Week. And welcome back. Today through May 12th, we're celebrating National Nurses Week. Nurses are critical to the health and well-being of patients, and it takes a very special person to wear the uniform. The Visiting Nurse Service of New York is here tonight with us with the 5 things you did not know about nurses but should. Neely Bagley, a registered nurse with the Visiting Nurse Service of New York. Thank you so much for being here. Welcome.
Thank you for having me.
Everybody deals with the nurse when they go to the doctor's office, and so this is a very important thing for everybody to pay attention to out there.
Absolutely.
But how did you end up becoming a nurse? It was after 9/11. What was it that called you?
Yes. Yeah, well, I just felt very bereft at all the tragedy that occurred, and I felt I had nothing to really offer in terms of help. And I really wanted to be of service, and I decided just to go back to school. And I always loved medicine, so I decided to become a nurse.
Okay. Well, I mean, people can feel that call, but it's one thing to feel that call, feel that urge, and not do anything about it, not act on it. You actually acted on it.
Yeah.
How difficult a decision was it for you?
Well, it was tough. It was tough going back to school at an older age, and you know, all the studies that I had to do. But I really feel I had a calling for it. I was fascinated with everything that was taught to me, and I just soaked it up like a sponge.
Which is what you have to do. There's 5 things you might not know about nurses but need to. That's kind of what National Nurses Week is kind of based around here. Let's talk about those 5 things. The first is that nurses are educated, but they also educate.
That is correct. We are educated. We're associate degrees, bachelor's degrees, master's degrees. Some of us are nurse practitioners. And a big job of a nurse is to go in and educate the patient about how to manage their illness. Sometimes it's a chronic illness, sometimes it's a little more acute, like you have surgery and you come home from the hospital. But we're the ones who teach them all about disease management and lifestyle changes.
But the industry and medicine is constantly changing, really by the day as research helps us get further along on things. And of course, technology is changing. I would imagine part of being a nurse is learning every day yourself.
Absolutely, absolutely. There's a lot of learning. It is a computer age, so in addition to learning medicine, everything is done on computers, so we have to be computer literate as well.
Nurses are tough as nails and immune to bad smells. There's nothing that can prepare you for what you see as a nurse.
No, not at all. Not at all. I won't get into the bad smells part. I think you can use your imagination. But we see a lot of things that are difficult to see. And we deal with wounds that are overwhelming for patients, even overwhelming for caregivers, families. And we have to, keep a professional approach and do everything on the evidence-based practice to get the best resolution to issues like that.
Okay, nurses are the eyes and ears of physicians.
Absolutely, absolutely. You go into the doctor's office or in a hospital setting, and you get what we call the white coat syndrome. And you're it's such an aseptic smell. Everything is unfamiliar to you, and you're taught all of this new information. It can be very frightening, and again, it can be very overwhelming. And you come home really not remembering a lot. And the nurse's position is to go in and reteach in an environment, in a home, in the community where the patient feels safe and the stress level is down and they learn much better.
And nurses aren't just people you see in hospitals. Nurses are also there with calm and care. That's the most important.
Absolutely, absolutely. When I go in to see patients, I bring a lot of compassion, I bring a lot of care into this. It's all about developing trust. It's all about being able to get people to listen to what you're teaching and really understand and put it into action.
Well, we thank you for listening to the call that you felt so many years ago to get into nursing, and thank you for being with us here today to educate us about this National Nurses Week as we celebrate Neely Bagley. Thank you.
Thank you very much.
All right, we will be right back. Stay with us for more here at News 7.